Hey all, welcome to one of the easiest and one of the important topics in pathology, that is benign versus malignant tumors. We will compare both of the benign and malignant tumors, and we will also see images, and we will at the end of this video all of you will master this topic. And let's get into the video. So what are benign tumors? Benign tumors are localized neoplasms and they are composed of well differentiated cells. Okay, so benign tumors contain well differentiated cells while malignant tumors contain poorly differentiated cells. So both are neoplasm, and benign tumor is localized neoplasm which is composed of well differentiated cells, and malignant tumor is a neoplasm composed of poorly differentiated cells. And benign tumors are the localized neoplasm composed of well differentiated cells and which does not metastasize. So this is one important. This is the primary defining feature of a malignancy. So malignant neoplasms are neoplasms composed of poorly differentiated cells and they metastasize. Benign tumors slow growly and they does not invade or metastasize, while malignant tumors shows invasive growth. Invasion means direct local invasion. Invasion means they can invade local tissues by direct extension into the local tissue is called local invasion. Metastatic tumors can show invasive growth and they have the ability to metastasize. Metastasis is the ability to form a secondary tumor at a location distant to the primary tumor. Okay, I have done a video on the metastasis and invasion. If you want, you can go on batch. So first let's compare between the growth rate of benign and malignant tumors. Benign tumors grow at a slow rate and malignant tumors grow at rapid and erratic. They grow at rapid rate or they have erratic growth, and benign tumors due to slow growth rate they have only very few or normal amount of mitotic figures. What are mitotic figures? These are the spindles, mitotic spindles formed during cell division. Due to slow rate of growth, they undergo less mitosis. This is what is meant by slow rate of growth. So they have less mitotic spindles. While malignant cells, they have rapid growth rate, they have rapid proliferation, so they have numerous or abnormal mitotic figures. Mitotic figures are numerous and also are abnormal. Okay, we will see the diagrams. Okay, so differentiation. Next feature, differentiating feature is differentiation. Second, first growth rate, then differentiation. So the benign tumors are well differentiated, that is they resembles very much to the tissue of origin. Okay, malignant neoplasms are poorly differentiated, or we say anaplastic. Anaplasia means lack of differentiation. Anaplasia itself is a short note, and they are anaplastic, and there is a loss of resemblance to the normal tissue. Okay, differentiation is the degree to which a cell resembles the normal tissue, and benign neoplasms are well differentiated, and malignant are poorly differentiated or they exhibit lack of differentiation or called anaplasia. Anaplasia is an important feature of malignant tumors. Next, the cellular features. So the benign tumors have uniform cells, that is, cells are arranged uniformly and also they have uniform size and shape. Okay, all cells have similar size and similar shapes, and with the normal nuclear cytoplasmic ratio. Normal nuclear cytoplasmic ratio means 1:4 or 1:6. Okay, uh, and they have minimal pleomorphism. Okay, what is minimal pleomorphism? Pleomorphism is the variation in size and shape. Okay, they have the cells have similar size and shape, so they have minimal pleomorphism. Okay, while malignant tumors have increased nuclear cytoplasmic ratio, that is, sometimes it reaches 1:1 ratio. That is, suppose this is the cytoplasm, then some cases the nucleus can reach similar to the size of the cytoplasm. So the nuclear cytoplasmic ratio can reach up to 1:1 ratio, and cellular pleomorphism is an important feature. Pleomorphism means variation in size and shape. Okay, this if this is one cell of a malignant neoplasm, then another cell may have like this shape like this, another cell may have shape like this, and the nucleus can also have different shape. Okay, nucleus can have a shape like this, one can have shape like this. There can be variation in size and shape between the two cells of the same tumor. Okay, and they can have prominent nucleoli. Now let's see this image to study about the anaplasia. Anaplasia. What is anaplasia? It is the lack of differentiation, and it is an important feature of malignant neoplasia. Features of anaplasia include all these features. These features we talked in cellular features, that is pleomorphism, hyperchromatic nuclei, then increased nuclear cytoplasmic ratio. Okay, you can see. So this is a normal epithelium, and this is a malignant tumor neoplasm, and you can see the basement membrane is invaded, so there is a local invasion here. You can see local invasion. So this is a feature of malignant neoplasm, and you can see the size and shape of the cells and the size and cells of shape of the nuclei differs, which means cellular and nuclear pleomorphism can be seen, and there is difference in the there is loss of polarity, means there is no particular order in which nuclei or cells are arranged. Okay, some are arranged like this, some are arranged like this. There is no polarity. Okay, some are arranged like this, so there is loss of polarity. Then there is increased nuclear cytoplasmic ratio, and also nuclei are hyperchromatic and they have coarse chromatin. Okay, also this is the normal mitotic figure which can be seen in normal cells and also benign neoplasms, while malignant neoplasms have increased number of mitotic figures and also they have abnormal mitotic figures, which means normal mitotic figure is bipolar, abnormal means it can be tripolar or quadripolar, and also bizarre cells or tumor giant cells, which are large cells, and tumor giant cells are large cells with multiple nuclei. These bizarre cell or tumor giant cells can also be seen in a malignant neoplasm. So these are all features of anaplasia. Okay, anaplasia is the appearance of cells in malignancy. Next is the capsule and mode of growth. Benign neoplasms are usually encapsulated. They are covered by a capsule and they show expansive growth, and they can compress the surrounding tissues. But malignant cells are non-encapsulated and they can also compress, but they shows infiltrative and invasive growth. They can infiltrate and invade into the adjacent tissues. Okay, this is an important feature of malignant tissues, and infiltration is not seen in benign neoplasms. Next is feature is metastasis and recurrence. Okay. Benign neoplasms metastasis is absent, and in malignant neoplasms metastasis is present, and recurrence is rare in benign neoplasms after surgical removal, and recurrence commonly occurs even after treatment in malignant neoplasms. And examples for benign neoplasms are adenoma, lipoma, fibroma, and for malignant tumors, examples are carcinoma, sarcoma, and leukemia. So this is the final differentiating feature. These are the final differentiating features between benign and malignant neoplasms. Okay, you must study this, and you can get full marks in exam even if you only study this table. Okay, so this table is taken from Ramdas Nayak textbook. And coming to the microscopic features, benign neoplasms are well differentiated and malignant are poorly differentiated. Actually, they show variable differentiation. Some show well differentiation, but most are poorly differentiated or they have lack of differentiation or aneuplosia. Aneuplosia is characteristic of malignant neoplasm. Then they show benign does not show pleomorphism, and malignant show pleomorphism, means variation in size and shape of cells and nucleus. And nucleus is normal in benign neoplasms. Nuclei are absent, while in malignant nucleus is hyperchromatic and they have irregular border and are pleomorphic, and nucleoli is prominent in malignant, and mitotic activity is normal or normal in or low in benign, and it is very high and show numerous and also abnormal mitotic figures, that is tripolar, quadripolar, multipolar mitotic figures are seen, and tumor giant cells are not seen in benign neoplasms and they can be seen in malignant neoplasms, and show nuclear atypia, means hyperchromatic irregular outline and pleomorphic nuclei. And nuclear cytoplasmic ratio is normal in benign neoplasm, which is 1:4 to 1:6, and it can be increased in malignant, that it is up to 1:1, and polarity is maintained in benign, which is lost in malignant. Chromosomal abnormality is not found in benign and is usually seen in malignant neoplasm. Coming to the gross features, capsule is present. Benign neoplasms are well encapsulated, and malignants are not encapsulated, and also areas of necrosis and hemorrhage are not seen in benign, but in malignant neoplasm we can see necrosis usually at the center of the tumor. You can see the necrosis, area of necrosis. Okay, this is one of the gross feature of malignancy. And rate of growth is slow in benign, while it is rapid in malignant, and local invasion is usually not seen in benign, but malignant are locally invasive and can infiltrate surrounding normal tissue. Local invasion is absent in benign due to well encapsulation. Okay, and metastasis is absent in benign, and it is present in malignant. Okay, metastasis is the primary defining feature of a malignancy. Okay, and prognosis of benign tumor is very good, and malignant is very poor because death can occur due to metastasis. Okay, that's all. Thank you.